The first one's Joanna Hikaka, who many of you know already. She's a co-director for the Centre of Co-Created Aging Research at the University of Auckland. She is a registered pharmacist with over 20 years experience in clinical practice in Waitemata. Jo's clinical and research work focuses on older adult and Maori health, spanning primary, secondary and aged residential care settings. Jo.
Thank you, Hamish. Kia ora koutou. So thank you for the opportunity to present again today. This session is taking a little bit of a different track to the previous one on AI and providing summaries. This one is talking about interRAI checkup self-report as part of a community care intervention. And it's lovely to have people in the room like Whaia Hariata who've contributed to earlier work in this space. So as you know, mandated interRAI assessments are required for access to publicly funded aged care services. And we've talked about trained assessors today. So you need a trained assessor to complete an interRAI assessment, and they need to have assessment as part of their scope of practice. And there's a variable availability nationally of trained interRAI assessors, and within some health regions there's longer waiting lists than in others. And Etu gave a great presentation this morning talking about the ways in which people may or may not be able to access interRAI assessments and different stages of falling out of that sort of pathway to the actual provision of care and health improvement. So we did some work looking at the checkup self-report, which is one of the interRAI instruments, not used in New Zealand currently in practice, but it allows people to provide their own perspectives on their health and well-being as opposed to it being assessor-led. It's self-completed and it embeds, similar to the other interRAI assessments that we commonly use, it embeds algorithms to support care planning. We did some work in Rotorua to understand, with Korowai Aroha, to understand the role that kaiarahi or paiarahi, so health and community navigators, whānau order navigators, could have in supporting the completion of this checkup self-report, as well as the care coordination, care navigation and advocacy that could come out of that as part of that assessment process. So why did we look at whether that would be an assessment tool we could use in that setting? Well, if we think about research in general, particularly surveys and Indigenous populations, there is a colonial history. Research has often been extractive, it's been harmful. Māori and other Indigenous populations have fallen into the studied other. And this carries into contemporary perceptions and also contemporary practices often. So when we're introducing new tools, we do need to understand the feasibility, but also the acceptability of these tools. And so we did some work looking at paiarahi facilitated checkup self-report in older Māori in one region of New Zealand. So that region was Rotorua. And so I sort of came into this project later on. So Korowai Aroha and interRAI services were thinking about, could this checkup self-report work in their settings? And so briefly we looked at this, and it took around 30 minutes for the paiarahi to complete the assessment. So although the checkup self-report is a self-report tool that can be done by the person themselves, almost everyone would prefer it be facilitated by the paiarahi, and they perceived that there was improved access to healthcare, so that perception was from paiarahi as well as the people that were assessed. Important to know, in this feasibility study, we only included people that had never had an interRAI assessment before, were thought to not need an interRAI assessment, so they were, considered a generally well population, Māori aged 55 plus, and we included 50 people in this feasibility study. And so embedding it into clinical practice was really important. So the paiarahi that completed the assessment were employed by Korowai Aroha, and so had access to the full clinical team to support care planning. The health navigator role was seen as essential to participants to ensure success. So it was someone from the community known to people, could establish a good relationship with people before interRAI assessment was completed. interRAI, who supported the training of paiarahi to complete the assessment, said that training requirements were similar to other assessors. So although it seemed a bit similar to other assessors, there was a couple of days training, and then interRAI trainers and educators looked at the first 5 assessments, but felt that the initial training and ongoing support was similar to that which might be required by the sort of standard interRAI assessors that have assessment as part of their scope of practice. So we're thinking about acceptability. This is one of the comments that it's important to think about, and it's similar to what's been talked about earlier today. So one comment was it's like a Pākehā assessment. So when you're completing that assessment, you look through a Pākehā lens and think about what's available in the Pākehā system. So you close off your world. So it's important to understand that this is just one tool, and that there's other, sort of holistic approaches that are needed when you're assessing people, and also care planning and supporting navigation. That study has been published, so if people are interested, they can look at that. I'm moving on to Wairoa now. So Wairoa is a township, a district on the east coast of New Zealand. This is the area shown here in orange. It's reasonably remote. So Wairoa is usually is around 2 to 2.5 hours from Hastings, which is where their main hospital is, where their secondary care services are. However, it gets more remote. So Wairoa has been, severely impacted by natural weather, extreme weather events in the last few years, as well as previous to this. So during Cyclone Gabrielle, the township was flooded. Around 40% of the housing stock was impacted. Even 3 years later, approximately 25%. They're down about 25% of the housing compared to what is needed. So there's lots of people living in houses they might not normally live in, together with whānau. So prior to Cyclone Gabrielle, because of difficulties maintaining a hospital level workforce in their aged residential care facility, their hospital level beds were closed. But post Cyclone Gabrielle, the facility was red stickered. So now they do not have an aged residential care facility. People either go to Gisborne, Hawke's Bay, like Hastings, Napier, or across to Rotorua. But Wairoa is a very strong, resilient community, and really well connected. So this is a story that was in the newspaper about the mayor of Wairoa going to get Gavin back from Rotorua. So there was a community petition asking for Gavin to be returned home. So a housing solution was supported for Gavin, who used to live in the aged residential care facility. And this is just a demonstration of the community supporting others to return households to a bit of normality post extreme weather events. The Cyclone Gabrielle was 3 years ago, but there's still been significant weather events that have occurred in the last 3 years that mean, it's now a 5-hour trip by road to Hastings, or it's a helicopter ride because the roads are completely shut. And Wairoa isn't the only community that's been affected by this. So there's lots of road closures right along that east coast at the moment and up in Northland. So at the point when the hospital level beds were closed, NAIRI was asked to go in and provide some support around what solutions could be. And so this ended up being an opportunity for us to engage with the community and understand what research priorities there were there. And so we've done a few different pieces of work. And again, I just wanted to highlight, similar to this morning, how, taking an approach that's community driven to respond to things that are important is how we should be thinking about research, I think. So we wanted to understand what residential and community care for kaumātua could look like. We've undertaken research development workshops with people in the community to understand what their priorities are. We've supported to provide some reports in this aged care space, thinking about what co-designing aged care in Wairoa could look like. And Leigh has also been involved in some work looking at the access to interRAI assessments post-hospital level closure of the hospital level beds and post-cyclone. And we're still to sort of really refine that, but it really does look like that event has reduced access to interRAI assessments. So as part of this research, we wanted to understand what research priorities would be in the community, and the biggest priority was they need an aged residential care facility. And we've tried to be very transparent all the way through that even if this is what we hear, we can't then come and get a research grant that will fund an aged residential care facility. But we're trying to work with people to understand what information would be important to advocate for the equitable resourcing in that area. So, similar to Etu, we're wanting to know who's not currently getting interRAI assessments. And we're taking a traditional epidemiological approach. Firstly, so we're door knocking. We're going into the community. We aim to knock on 888. We aim to include 888 people, which we are proposing will mean knocking on at least 1,200 doors. We're working in partnership with Kahungunu Exec and Rongomai Wahine Iwi Trust, who already have kaiarahi employed there, so health navigators employed there. They will be the ones doing the door knocking. In Wairoa district, there's about 9,000 people, 70% Māori population around, and we're aiming to include around 30% of the population, 55 or older, in our study. The reason we like this door knocking approach is that when we talk to people, they say, oh, I know so-and-so up the road and they'd really benefit from this, but they'll never come into something like your service, or they'll never ask for help, or they may not even think to do that. It also kind of mirrors an approach taken by the Māori Women's Welfare League in the 80s, where it was the first public health survey really that understood Māori housing, and that was really influential in arguing for equitable resourcing to support Māori housing and public health in that space. So we are aiming to do a check-up self-report. And when I say this, we didn't go and say, let's do a check-up self-report and let's door knock and do it. The community said we need more information to be able to justify an aged residential care facility. So you will have, I don't know if you will have seen, but the media's been full of Wairoa talking about needing an aged residential care facility. There's issues with capital funding of it. There's issues with workforce, maintenance of workforce. And it was really fortunate that we'd done work with Korowai Aroha to understand what it looked like implementing check-up self-report in communities. And that was put on the table as one of the many assessments we could do. So we're doing check-up self-report, but we're also asking all these other questions generated by the community. So what's the digital access like? What's your emergency preparedness like? We are asking, do you look after other people? How long have you lived in the area? What health services do you access in the area? Where would you prefer to get your healthcare? Because part of the district is Mahia, and that's where Rongomai Wahine Iwi Trust predominantly provides services. Mahia is about 45 minutes from Gisborne, but it's about three and a quarter hours from Hastings, but Hastings is their hospital. So, just gathering information like that to help think about, why do these borders exist? What's the reality of these borders? Why is there not choice? We're also providing information, and part of the last couple of years we've been talking to people about what they think of different resources and whether they might be useful. So we've chosen one as a group that might be useful to give to everyone. It's the Navigating Wellness book that was put out by Third Age Health, and it just provides people the opportunity to do some little assessments themselves and get themselves ready for health or connecting or understanding, vision and hearing. But we're also thinking about this act of visiting as an intervention itself. So although we're wanting to understand population level data, we are doing an intervention. So it's going through proper HDEC as an intervention. And so we are also asking permission to look at longitudinal data and link to current health data, but also look at longitudinally and also come back and ask people questions in the future. And that's all optional, so people can participate in assessments or questions without having to have any of the intervention or the goal setting or the coordinated care. So yes. So what we are hoping to do is to provide an interventional individualized intervention. So there's some benefit at an individual level, but also informed population level data. And so as part of this, we're engaging with communities, but also people in the sector to understand what information might be useful for them when they're making funding decisions, so that that can be included in the analysis, but also people are included in those conversations as we go along. So they're not waiting the end of 3 years for results to be published, and we're able to inform people as we go. And so just thank you and acknowledging our partners in this work and HRC for project funding for this work.
Okay, any questions for Jo?
Thanks, Jo. It's really inspirational work you're doing. I'm having a conversation with Nigel Miller a couple of years ago about we should be looking at the self-check thing. We're talking about specifically for the Pacific Islands, because it was something they don't have interRAI and, you know, Samoa and Tonga, and he thought it was actually quite a good assessment. Did you look at any other countries? He mentioned about, and I haven't looked at the research, other countries that are using it and how effective, and they were different ethnic populations, because it's quite cool you've done this in Māori already, but if you're interested in any studies you've come across.
Yeah, there's been some work done, particularly in Africa, and looking at lay assessors completing the checkup self-report, and it had quite high internal validity and also correlated well with clinician-led assessment. So it has been sort of validated in that space. So one thing I didn't mention is that the checkup self-report didn't completely fulfill the community's need for information in terms of health and well-being, and so we also are using the Hua Oranga tool alongside this. And so what we see is that it's got the ability also then for us to understand the ability of Hua Oranga to understand wellness and health in compared to interRAI assessment.
Hi, Jo, you mentioned there is no aged residential care facility in Wairoa. How many beds do they need based on their population?
I think it was about 30 beds. They say that they've got around 100 people living in their district currently that would be at hospital level care, which is about twice as many as pre-aged residential care facilities. So there was still a number of people living in the community that were hospital level care, cared by whānau, by choice. But
so none of those big organizations interested to open a facility.
Well, I don't know. And a lot of these things, there could be things happening on behind the scenes. Wairoa's got a very strong community partnership group, and so they've got about 30 stakeholders on that community partnership group. They've just set up a long-term care advisory group within that community partnership group. So we're working alongside that, so we make sure we don't replicate, but we work synergistically together. So and when we do hear conversations and try to connect people, because but keeping confidences as well. So
Any other questions? All right. Even acknowledge Jo for a great talk. Thank you, Jo.